girls, food allergies can be extremely dangerous, and it seems like they're becoming more prevalent. Joining me now is Dr. Halie Anderson and Dr. Abigail Finley to explain more. So food allergies seem to be more common. Is that true?
Yeah, it is actually. There's good data that in recent decades, the prevalence of food allergy has really increased. So now anywhere from 1 in 8 to 1 in 10 kids in a classroom are affected by food allergy, which is a significant increase in the last couple of decades, like I mentioned. Reasons for that are complex and varied, probably related to early life exposures and dietary changes and genetic predisposition, but it's definitely something that we've noticed and is true.
Yeah, you kind of already covered my next question, which was, why do you think this may be? Is there any other details you can give us?
Yeah, it's again, it's kind of a complex million-dollar question that researchers are trying to identify. Why is this happening? And we think that there's probably some environmental pressures because it's happening more rapidly than you would expect if it was just genetics. So probably something about our diets, the ultra-processed, low-fiber diets. We do think that kids become allergic through what we call sensitization through their skin. So if they have a broken skin barrier because they have eczema or dry skin and they're exposed to food proteins through their skin, they can become allergic. Maybe some effects of early antibiotic exposure and their microbiome. So it's pretty complex. We wish we could just nail down exactly why, but it's definitely increasing for sure.
For sure, and there's a lot of new tech that we talked a little bit on Good Morning Coded Territory. Can you tell me a little bit about that new tech that's coming into allergy management?
Yeah, so one of the really exciting medications that we are using now for food allergy is Xolair. It's an injectable medication, and where before we only had strict avoidance. If you were allergic to a food, you were going to strictly avoid it, use epinephrine if you needed a rescue medication, but there weren't really a lot of other options. Now with Xolair, we have an injection that's available for kids ages 1 and up as well as adults, and it protects against food reactions. So it doesn't at this point necessarily get you eating that peanut butter and jelly sandwich, but it gets you to the point where if you have a bite of your friend's peanut butter and jelly sandwich, you don't have a systemic severe food allergy reaction. And that's giving our parents and our patients a lot more peace of mind, because we hear all the time in the news about these sporadic events where patients do have fatal reactions to their food allergies, and to give those patients a layer of safety, to give them that confidence that, hey, if you go to that potluck and your kid accidentally has a bite of something that they shouldn't have, they have that level of protection there. That's been huge for our patients.
Yeah.
And the goal for us, hopefully eventually, would be that maybe we can use that to overall desensitize kids and adults to food allergy one day and get them eating that peanut butter and jelly sandwich if that's a goal of theirs.
All right, well, and as we sort of wrap up here, when should people see an allergist?
We are always happy to see patients. We recommend they always, can discuss things with their primary care doctor, but the history and the testing are really important, and it's really important to be done with someone who has experience in that area. And so if patients and, their parents or adult patients have questions about food allergies, we're always happy to sit down with them and figure out what's the best treatment plan for them going forward.
All right, well, thank you guys so much for joining me. Bright